Always remember, Manong knows.
Central London OSCE or London Hospital OSCE. You decide. Our Central London purpose-built NMC OSCE course and practice rooms include all of the equipment you need to practice for your NMC OSCE exam. You get the same expert team by your side, the same expertly prepared materials, and now a dedicated space built just for our international and return to practice nurses. And guess what? We've got an introductory special offer for when you book your NMC OSCE course at our website. Use company code LONDON to attend your 3-day Central London NMC OSCE course for an incredible $457.50. Learn more at www.oscenurses.com.
Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
Right. Good afternoon, Manong George. No? Ako nga pala, my name is Melvin. I reside here in Swansea, Wales. What else can I say? Been working here since 2002. And then we were the second batch of foreign nurses who fortunately enough to work here in the UK, or specifically here in Swansea. But after a few months, I felt like, oh, this is a good place to start to progress a career. Took up the course. I was fortunate enough to be sent to take this ophthalmic nursing course in Bristol, and it carried on. But from 2008 and onward, I've been developing myself in all aspects of ophthalmology, which is, you would think that it's just basically eyes. But what I always say to my students now, to the students that will come over in the department, I say, it opened my eyes basically, and including my Filipino friends, it really opens my eyes, because before I got very little knowledge of ophthalmology or eyes. When you say ophthalmology or eye condition, you would think of is red eye or conjunctivitis, and that's about it, or injury into the eye, But when I joined ophthalmology, it expounded my knowledge all in all, that there's so many eye conditions that can happen or it can occur. So since then, when I took up and finished this course in Bristol, I was fortunate enough to be, how can I say, rebanded, ika nga, no? But I really enjoyed the task. I really enjoyed and quite interested in doing skills, enhancing my skills. So I started off from the beginning. I started off getting myself involved into the medical retinal side of the clinic, which I was trained to do fluorescein angiography, to start with diagnosing a different kind of medical retinal condition. So the first step, doon ako nag-start, and then when I developed and enhanced the skills there, I decided to stick on the medical retinal things. So hanggat na develop and evolve with all these changes in the NHS, countrywide, and they were talking about redeveloping the role of the ophthalmic nurse. Because before, when I started in ophthalmology, outpatient department, they were just only considered these glaucoma specialist nurses. And then afterwards, na-expound na. So every section of the department has got their own specialist ophthalmic nurse. I was supposed to be the first nurse injector in Wales. And that was a couple of years ago when we were rebuilding the clinic. But anyway, I was still the first intravitreal nurse who performed this injection in the eye clinic in the trust that I'm working at. So, and then it evolved again after having treatment. Dual function ako eh. Hindi lang medical retinal nurse or ophthalmic nurse practitioner. I was also in charge of the outpatient ophthalmology department, which dual function, which is a bit of challenging really, because I'm the most senior staff that was left in the department. long as I'm going to be trained, But I've been doing the IVT injection for a couple of years already. And then he mentioned it to me like a year ago. Do you think that you're interested in pursuing this skills? I said, you know me as Mr. Williams, from the beginning, I'm always up for a challenge, So I said, we just need to make sure that everything is covered from the policy, from the vicarious liability, all of that, which I formulated as well through the help of my colleagues from other trusts. I've assisted it before, which is most of the time or all of the time before, it was being done by the junior doctors or the retinal surgeons or the retinal consultant. But later on, with the involvement of the NHS, which I've seen been happening for a couple of years now in terms of the nursing side of things, I've seen that it's going to evolve to be run by non-medical, not just nurses, but non-medical practitioners. But as I said, I was quite fortunate to be offered and be guided to do this treatment, to the patients that needed this treatment, which is very vital because all of the patients that we treat are needed all this type of treatment. It's not just this Ozurdex or this steroid implant, but still the IVT or anti-VEGF injection. Patients who suffers from diabetes, who suffers from CRVO or RVO patients. So we are starting to catch up on the backlogs kasi talagang kulang ang the waiting list is quite long. But because of this, and hopefully a lot of my colleagues will take this as well, take it forward, and we can build up a group of bigger team to administer this treatment that is much needed for the patient.
Generalist, nasa general wards, yes. Hindi pa nila ma-appreciate lahat. Kasi katulad mo, sabi mo nga kanina, kahit ako, ang alam ko lang sa mata, yung sore eyes. Yes, alam lang natin glaucoma, yeah. 'Di ba? Hindi natin. Pero on somebody who might be starting, how does this help a patient?
Ang advantage ko bilang nurse na na-involve sa clinic is yung rapport na na-develop from the very first stage. Nung nakita sila, bago sila na-diagnose, as tsaka I think yung level of care natin masyado tayong compassionate lalo na ang mga Pilipino. Hindi lang, I'm not being prejudiced against my UK colleagues, no? Pero sa mga pasyente na rin ang galing na, oh, you're so caring, ganyan. Well, we always take that as a compliment, pero siguro second nature nating bilang mga Pilipino na we always treat them, sa akin kasi, I always treat them as my aunt, my uncle, how would I like my relatives to be treated and myself. Ganun ako mag-treat ng pasyente ko Yun ang advantage sa mga pasyente, is especially doon sa clinic namin, which is an urgent condition that needs to be sorted. For example, yung age-related macular degeneration, it needs to be treated as soon as na mag-diagnose sila to save their sight, whatever sight they have remaining. With the diabetes, unfortunately, it's a chronic condition. But if you don't see them on their appropriate time, they will also lose their vision. So sabi ko nga, in terms on different sa hospital setting, different hospital prioritization. Pag uma-attend ng mga meeting, we always feel like, kasi porket ba ang ophthalmology hindi life-threatening, lesser na ang priority. Sabi ko, can't they understand and look into the analogy? It might not be life-threatening, but it is a life-changing situation. Naging advantage ko na nakita ko sila from the very beginning, na ma-diagnose sila up to the point na may review sila, may appointment sila every month or every 6-8 weeks, and up to the form na kailangan nila ng mga treatment, andun pa din ako. So, ang comfortability nila sa akin, ganun-ganun na lang. Kasi kilala nila ako 7-8 years ago na nakita din nila yung progression Sabihin na natin yung color ng uniform, no? Nakikita, oh, you got wearing different uniform. Have you been promoted? Something like that, no? Sabi ko, no, I'm still the same. Sabi ko, still the same what I'm doing. It's just, different, more responsibility. Ika nga. So, yun ang advantage eh. Yun ang naging edge of a nurse handling this type of responsibility. I forgot to mention, Manong George, no? Besides sa medical retinal, involved din ako sa cross-linking corneal cross-linking. So, fortunately again, we are the only cross-linking unit established here in Wales. Itong trust na pinagtatrabahunan ko. So,
if you give us an idea, sir, what does corneal cross-linking mean? Yan, para sa katulad kong hindi nakakaintindi kasi technical term yan eh. Yan.
Okay. Kasi ang mata, may iba't ibang part ang mata eh. Meron yung anterior, which is sa harap, tapos meron yung likod, intermediate yung gitna, at yung likod ng mata, which is the posterior side of things. So yung cornea kasi is the window of the eye, itong harap, harap ng mata natin. So ang corneal cross-linking is a form of treatment na yung mga pasyente na merong condition na tinatawag nating ito yung technical term, hindi ko masabi ko ano yung pinaka-simplest way. Yung tawag na keratoconus simply means yung part ng cornea, sabihin na natin dapat ang cornea natin, yung layer ng eye is dapat pantay siya at hindi siya kulubot, yung may umbok. With patient who's suffering from keratoconus, may part ng eye, ng cornea na manipis, yun ang umuumbok. Imbis na curve lang ang cornea, mayroong part ng cornea na nakaangat. So that resembles na sa sight nila is very blurry, which a lot of young people suffers, no? Mayroon kaming pasyente 13 to 15-year-old onward eh. So ang therapeutic claim ng having a corneal cross-linking, which involves how can I say, scraping, removing the outer layer of the cornea, and then administering this solution, which is riboflavin, and then exposing them to UV light. So that will give them a chance para maging rigid yung cornea nila, mas maging matigas ba, para hindi siya magkaroon ng bulging. So yun ang ginagawa naming treatment sa mga pasyente sa corneal clinic.
Ang lumalabas sa akin dito, no, it just shows na highly specialized na yung skill nyo, sir, no? Lumalabas yung technicalities talaga eh.
No? Fortunately, kasi ako siguro sa nature na rin, kasi I always, how can I say, hindi ko naman masasabing adrenaline junkie ako, no? Pero I'd rather be involved sa skill-wise, ma-develop yung skills ko kaysa maging stagnant na empleyado ako. Kasi parang na-feel ko before na parang maboboard ako dito. Sabi ko nga, from the very beginning na nagtrabaho ako, pag hindi mo love yung trabaho mo, kung ang motivation mo lang is kung other factor lang ang motivation mo, you're not gonna last long. It will come to a point na maski sabihin natin sumweldo ka ng malaki, pero at the end of the day, mababurn out ka rin pag hindi mo mahal ang trabaho mo eh.
Pag outpatient kasi walang extra. Di ba?
Correct.
Yes. Walang enhancement. Malaking
Correct.
bagay yan. Malaking usapan
Definitely.
yan.
Definitely.
So, ano naman yung magiging advice niyo, sir? Why would you go to that route? Yan. And why take the specialty that you have? Yan. Tell that to our nurses.
Okay. To all my nursing colleagues who had the privilege to work here in the UK, this is a good place to enhance your skills. Comparing from back home in the Philippines, I know that they do have specialized nurses there, but the opportunity for us to develop more specifically in other subspecialty is here. We got every opportunity, study days, different type of field of nursing, subspecialty of nursing. It doesn't mean that I work in ophthalmology, it is for everybody, It is not for everybody, but this is a place, this is a field that you can develop your skills wherever field that you wanted to be, whatever subspecialty. I've seen it myself all throughout the years na every aspect of nursing here in the UK, merong nurse practitioner or nurse specialist. Mapa-eyes, mapa-diabetes, mapa-wound care, endoscopy, lahat, endocrinology, lahat ng aspect ng field ng nursing, there will always be a nurse specialist. Especially nowadays, in the ever demanding NHS, the diversity of healthcare is happening, this is a very good opportunity for everybody who wants to specialize in whatever field they feel that they will like and improve or develop themselves. As long as you first and foremost always trust God, diba? I always say this to my colleagues, no? Every time I always pray na always guide me to give treatment safely sa pasyente. Kasi wrong move, you can inflict more damage than treating them. So, ang advice ko sa mga newbie or mga kababayan ko, mga nurses dito sa UK, no? This is a place that you can dream whatever you want to be. It's just a matter of proper dedication. And how can I say that? Kasi ito yung isa sa mga lessons na binigay ng father ko sa akin that I will always remember, because my father was a Chinese national. Hindi siya masyado matagalog when I was growing up because he's a full-blooded Chinese, no? So, but this is one thing that I would never forget what he told me, He said to me, someday, pero Tagalog to, utal Tagalog siya. If you want to dream big, if you want to achieve something in your life, don't ever step on somebody else's to achieve that. So wag sa Tagalog, wag kang mananapak ng kapwa mo para makuha mo yung gusto mo.
Always remember, Manong knows.
Manong knows best, put your worries to rest when